This is the first time we run into this. But welcome to office hours. February, here we are. So we'll get into the agenda for today. Jess, if you'd advance. So as always, we're recording. I just turned on the recording. And if folks have questions along the way, feel free at any point to chime in or ask in the chat, and we'll stop and we'll review and discuss. So today's agenda is going to be policy and procedure updates, children's updates, NetSmart, some more stuff on the CES tool guidance that was updated by DOH, eligibility and appropriateness assessment we'll touch on again. We want to talk a little bit about the DataDen low rate code reports that's currently in DataDen, touch on the comprehensive chart audits that we conduct through the Lead Health Home, and then the plan of care upload status, how that's going, and health home referrals we'll discuss, and then just touch on the advocacy that's happening on the front for the budget for health home through New York State. Jess, if you move on, please.
Yep. All right, my slides anyways. Everyone can still hear me?
Yep.
Okay, I just have PTSD when it comes to volume in WebEx. All right, so we're going to be covering the complaints policy and the conflict-free case management policy. Those were updated and sent out. Then we do have a bunch of upcoming policies that are due for their annual review. Most of them have no to very minor changes. Those are going to be our care transitions policy, eligibility and appropriateness criteria, HARP oversight, health home billing, health home plus for SMI and AOT. A children's waiver policy update for EMOD, VMOD, and vehicle or assistive equipment, and then our notice of decision policy. So all of those will most likely be reviewed next month. Complaints policy. This was an annual review and minor updates. We have updated the number that if a member wants to file a complaint or grievance with the health home, as always, they can directly contact the health home to do this. If they choose to go an anonymous route or a different route, we do have an updated compliance number in our policies. You just want to double check to make sure that you're giving out that new number to your members that you have. It actually goes straight to our compliance officer. So there is a new updated number in there. The other thing that we're going to be doing is we have a health home compliance committee. Also, our compliance officer sits with us on that. So quarterly, we will review all complaints and grievances that have come in. The one thing that we're going to assess for is just maybe network trends that for complaints and grievances, or if there's trends amongst an individual CMA with complaints and grievances, just taking a look at those. Does anybody have any questions on that? All right. Next, we have conflict-free case management. This policy is really targeted towards any of our children's CMAs that operate under AHI Health Home and operate a provider portion, so an HCBS services as well. So you have two sides of the house. There was no revisions to this policy. Just a reminder that if you are a CMA that is under AHI Health Home delivering care management to children, and you are also an HCBS provider, to please send me a copy of your internal conflict-free case management policy. I do have to have those on file for review and audit by DOH when they come in to do redesignation. Does anybody have any questions on this policy? All right. As always, if you have any questions, just reach out to the health home and we will get those answered for you. Moving on to children's updates, just a couple of things that I wanted to throw out there. Nothing major going on right now. For those folks that serve children who are in HCBS, they as in the state is looking at potentially a billing block if we do not get our K codes removed quick enough when a member disenrolls from HCBS but stays in health home. This really, I'm just notifying the network. It's not a big issue for us. We have a small population that's pretty manageable, and you guys are really good about doing what you need to do to get those K codes removed. The one thing I just want to continue to encourage you to do is that if you don't see the K code down and I miss something, to please let me know, because historically I have had to reach out to DOH personally to have them removed because they're not quite efficient over there. So if you do see that, please just continue the process that you're doing. I don't think this will be an issue for us, but they are looking at this statewide, doing a billing block. The other thing that's in development for that HCBS population and children is going to be a level of care certification course. They're looking at developing a certification course in the UAS, not just like the CAN certification course, but similar format, that you would have to be certified in the level of care in order to complete it. So you would have to go through a training, you'd have to receive a certification, and then you would be able to complete a level of care on those youth enrolled in HCBS. That's all the information that I have on that right now. I have not seen it. I don't know how long the course is. I don't have any of the details, but I just wanted to give everybody a heads up that this is something that they're working on, and they're looking at launching it this summer. Switching gears, I had sent out an email from DOH regarding the CAN's updated algorithm. They had been asking for kind of some specific examples on some targeted population that we serve. Most of it didn't fall within any of our CMAs, but they're looking at specific examples where we have been serving a youth potentially at a high acuity. And then when you redid their CANs under the CANs 2.0, their acuity dropped, and it's not reflective of the work that you're doing. So they're looking at reviewing some very specific cases if we had an example to pass along to them. If you don't, that's fine. They're looking at about 30 statewide, so we may not have any to actually give them. And the format would be similar to the case review that we did the last time with the CANs group, how they came on, you sat with them, you reviewed your case. So it would be similar to that if you did have an example that you wanted to pass along. If you do, please email me directly and I will compile that information and get it to the department. And then lastly, another update on our HCBS youth. On the 20th, which I think was last Tuesday, I sent out an email with some updated forms. They have updated the HCBS referral form and the Health Home Care Manager authorization notification form. And they've also added an instructional guide. They stated that those forms were to be used immediately. They have since decided to retract that statement and make them required come April. I would like everyone to start using those immediately so we can get in the practice of using the updated forms. I updated your HCBS toolkit in that email. So please make sure that everyone has that updated toolkit, all of your care managers, because that contains all of the paperwork they could possibly need. And then also they put in an instructional guide for that Health Home Care Manager notification form that really is geared towards HCBS providers because they're really responsible for completing that form. But it's really good for the Health Home Care Manager to read through so they know what they need in order to do the next step of the HCBS process and what to look for. So if anyone has any questions on anything that regarding HCBS, please reach out to me and let me know. But does anybody have any questions on anything I just went through? All right. Travis, you're up.
All right, thank you, Jess. So plan of care upload for health homes. I just wanted to touch on this again. I know we've talked about this over the last handful of months, but just wanted a reminder for the network that as of the 31st of March and moving forward, there will be a billing block that MAP will put in place if plans of care are not uploaded from the health home to MAP that have been completed within the 60-day timeline as required. So I can't stress enough that if you got someone that you've enrolled, make sure you get those plans of care done within the 60 days, finalized in NetSmart, so that that information can be pulled and uploaded to MAP. We're in pretty good shape as a network. We actually just pulled our numbers yesterday, and we have close to 2,400 plans that have pulled over into MAP. So that's pretty much the majority bulk of our network as far as enrolled membership. So we're pretty close to that number. But I just want to stress that, you know, as you're moving forward to get those plans of care within the established timeframes, or MAP will block billing potential. Any questions on that? I know it's a constant reminder. I just don't want folks to get into a situation where they can't bill. Okay, next slide, please. Here's a situation at the state. We were just on the DOH office hours last week, and they came up with another update to the CES tool. So next couple slides, we're going to go through those updates that the state is putting forward. The first of which, there's now going to be a billing block that's going to be implemented on the CES tool as of 5/31 of 24 moving forward for any CES tools that would have been due from November through May. So as we started November of 1st of 2023, when a CES tool first became a thing across the health homes in the state, now there's a billing block that's going to go in play as of May 31st, 24 moving forward. So what does that mean? So that means any CES tools that would have been due as of November of last year going forward have to have been completed and get pulled over into MAP as well. If they're not there and they were supposed to have been done, then that's going to be an issue for a billing block. So what we're asking is for folks to go back and ensure that any CES that should have been done are completed, and that they're in before, you know, by May 1st ultimately, so that we can ensure that there's not going to be a block when that information pulls over on May 31st to MAP. And then as of June, same thing would apply for June moving forward. Any CES tool due in June would have to be done before the end of that month so that it can be pulled over, so that there's not a block. So that is a thing now moving forward. So what does that mean network-wise? Jess, if you wouldn't mind just transferring to the next slide, please. So that means we have to look at our policy. We had said as a health home originally, when the CES tool came out, that we wanted to go by the comprehensive assessment due date. We have to adjust that now because of this billing block that's going into place. So what we're going to be doing moving forward as we update our policy is we're going to ask that folks use the month of enrollment for the individual, for adults moving forward, to ensure that that month of enrollment is the month that's going to be used a year from that point for that CES tool to be completed. So we have to, again, make sure everybody goes back for all applicable members that were supposed to be due in November through this point, and look at that month of enrollment, make sure that that CES tool is completed. And then we're going to have policy updating that in language that will get out to the network. I just wanted to pause if there's any questions. Jess, if I missed anything on that you wanted to further clarify, I just want to take a moment to pause on that piece, because it is a change. That billing block that came out of 5/31/24 for the CES tool moving forward is new. It wasn't expected. We were originally told it was going to be down the road. Well, now it's May 31st.
I do have a question, Travis.
Yes.
So just to be clear, this CES tool needs to be completed as the enrollment date. So when they were enrolled into the program, not when the POC or the assessment was completed?
So we're looking at the month of enrollment.
Okay.
It would be,
So
have to be
that
completed a month of enrollment.
technically that
So
could
you
be
would-
up to 2 months different then.
Well, the
Yes,
comprehensive,
it very well could be.
Okay, all right, thank you.
yeah, the issue that we're running into why we decided to go with month in enrollment versus the month of the comprehensive assessment, even though policy says 60 days, it's it's not the case in a lot of instances, which will be corrected as time goes on. But right now it would create a huge bottleneck because that has not been consistently the case in the past, where the comp assessments aligned for purposes of how the assess tool is rolling out. So we had to make that change to adjust so that we don't get people in a situation where they're not in compliance. Hope that was helpful. Any other questions on that? Jess, did you have anything else you wanted to add?
The only thing that I wanted to add is that, yes, this we got kind of dumped on by the state shortly ago that they were putting in this billing block. They told us it was going to happen. However, they made it seem as if we had much more time before that was going to be taken into consideration. And they had said to use, their annual assessment date. So we went with the comp date. They have since changed that, and they have said the segment begin date is the date that they will use for the billing block. So moving forward, the date that we're going to make reports off of in DataDen is going to be the consent date. So it's going to be the month the member consented to be in the program. I believe Taylor is publishing or has published today a report in DataDen that will give you the member's consent date. And then that will be the month that the SES tool is due. So this is going back for anyone who had an annual enrollment date in November of 2023. They did say that there is a 1 month grace period. So if you were due technically 12 months ago, there will be a 1 month grace period to get that SES tool done before billing will be blocked. So it's technically the 13th month, but you don't want to push it to that 13th month because you will risk that your billing is cut off. I hope that wasn't more confusing. My clarification.
Yeah, thank you, Jess. I appreciate the background expansion around it too. I mean, we want to make sure that people don't get a billing block. So we want to go the month of that consent, that month of enrollment as that trigger so that we can ensure that we're complying with the requirements of this tool moving forward.
So at this point, we really encourage everybody to go into DataDen and look at that consent report that Taylor either has. I'm pretty sure it's published at this point.
Yep, it's published, and there's
Okay,
a
thanks.
slide.
I couldn't remember if it was
In a
published
couple
or-
slides, I think we get into it.
Oh, perfect.
Yeah, we have it in our deck for the network to see and just get an idea what it's going to look like in the coming slides.
Yeah, so use that tool to kind of look back because there's going to be probably a handful of members that you potentially missed because the comprehensive assessment annual due date does not line up with that consent date. So there's probably going to be a handful of members. Go in, kind of catch up on your SES tools. At about April time period, us at the health home here, we're going to run a report to see who has been due, who has had one not completed, and then we'll try to get ahead of it and help send out some cleanup if need be. Don't rely on that. Go ahead and be proactive, but at some point we will take a look at that and see what kind of cleanup needs to be done. And then just for clarification, the SES tool, so that continued eligibility screening tool is just for adults. Children's annual eligibility is captured through the eligibility assessment. So that is different from this.
All kinds of billing blocks now that were not there before. So we're going to try and stay proactive on this. There's what we got: March, April, and then the month of May. So ultimately 3 months. I'd prefer to keep it to like 2.5 months to get it all tight. That way we can ensure that, folks don't get into a situation where something lapses and we have an issue. But Jess, if you wanted to move slide, then we can get into what the reports start to look like. And then the other thing that came up, and then the reports will be showing after these next couple slides, was around guidance clarification. So you all got the guidance document for the CESS tool, was forwarded. We reviewed in office hours in the past. The state has put forward, and I pulled their exact slides off for this, clarification on the supervisor discretion component. There was some feedback that they got that supervisors could override the result of the CESS tool, and they wanted to ensure that that is not the case. That's not what the intention of the supervisor discretion should be. If a person is deemed to be disenrolled and move toward disenrollment, and there's information to support continued enrollment, then the supervisor is able to pull that information to support the continuation of eligibility and appropriateness for health home, then that would alter potentially the results of the original tool that was completed. Jess, if you go to the next slide, and then the supervisor could go ahead and complete another CESS tool, or the care manager with the supervisor complete another CESS tool. The results of that tool, if it says continuation with health home, then that would support a continuation of health home. Again, it's got to be within the original 60 days of the first tool. If there's a recommendation to disenroll still, you have to go by that original CESS tool date. So that original 60-day window. It's not an extended 60 days from the date of the second tool that was completed. So that's a clarification that the state wanted to make sure that was out there. So we just want to make sure we got that to you all, and ask if you had any questions or anything you want to talk about around that. So it's got to be the supervisor provides additional information that would support the continuation of eligibility for the program, and the tool done again within the 60 days would have to also support continuation for the program. Otherwise, you have to go back to that original discontinuation within the first tool 60-day time frame. Next slide was initial appropriateness. We just wanted to remind folks that was just the third billing block. That was the effective 2/1. So appropriateness and eligibility has to be complete in order to bill, and it's got to be for adults and children. And the only exclusion is segments created through MAP through the transfer process. So all adults and children have to have eligibility and appropriateness for, within the first 30 days, or there could be a billing block. There's a question coming. Oh, I missed it. Okay, must have been some backfeed. Jess, if you go to the next slide, please. So just some clarification around the eligibility and appropriateness criterion. Again, the children and adults each have to have that completed within 30 days of enrollment. For the children's program only, this has to be completed annually to confirm appropriateness for health home. Jess alluded to that earlier on. And then just some clarification around the direct referral from MCO, LGU, or single point of access. That's been added as appropriateness criteria in NetSmart. And then each time a member has a status change, you have to do an eligibility screen within 30 days or billing will reject. So that's clear in the guidelines the state put forth. An example that we provide is if a person was in DSC and they went back to enrolled, you got to complete the tool to ensure that the billing can continue. Is there any questions around that? Any clarification anybody want to talk through? Okay, next slide, Jess. And then the actual snippets of the tools themselves in DataDen. So this is the first one. Taylor, do you want to talk about that?
Yeah, I could just, I mean, everything's kind of on the slide, but I feel like I get to talk about the fun stuff now that we laid all that out. We are making some good headway with the report. So I'm excited to have two different reports to share with you guys today. The first is the initial CES tool due by month that Jessica had mentioned. This is going to take into account the original consent date, and then it's going to give you the month that your CES tool is going to be due. So this report is just showing members that have been enrolled for 12 months or more and do not already have a CES tool complete. So if you've already done the CES tool for one of those members that's been enrolled for longer than 12 months, you won't see them on here, but this will be, like Jess said, a nice tool to kind of cross-reference for when we were using that comprehensive assessment date. You'll now probably see some extra members on there that you wouldn't have seen prior. So yeah, adding a year to the consent date in order to give you guys that CES month due. Next slide, Jess. And then the next one that we
This
now
is
have
Jared.
available
Can I
is
ask a quick
our-
question?
Was there a question? Or maybe just background noise. The next one that we
No,
have is
someone had a question.
Oh, go ahead. What?
Jared? I thought that he said he had a question.
Yeah, I thought I heard someone had a question as well.
Jared, you're muted again. You have to unmute.
Oh, I'm sorry. I'm sorry. I'm back.
Oh no, you're fine.
No, I clicked the button twice. In regards to the CES tools, it's still on hold for Health Home Plus and AOTs.
So we are still asking that you do the tool, but when you go in, you'll just select the drop down that says, I think it says Health Home Plus. I'm not sure if there's a button for AOT. If not, just select that Health Home Plus button and it'll mark that it's due. That way it won't, or done. That way it won't populate on any of the reports. But just for tracking purposes, we do ask that even if your member is Health Home Plus or AOT, you're doing the tool anyway.
We have to fill the whole thing in or just
You'll have to fill it in as soon as you select Health Home Plus. It'll just automatically let you save it without answering all those questions.
Okay, thank you.
You're welcome.
Was there any other
Um,
questions? That was a good question, Jared.
Yeah, good question. Okay, next, we have a new report for this eligibility screening. So this one in particular is for members that have been in appended status. So they've either been in excluded setting or DSE and have moved back to enrolled. So this will show you those members that need to have that updated eligibility screening completed within 30 days. And this one is called Status Change EA Due, and it's under the compliance section in DataDen. Any questions on this one? The initial CES report is also under the compliance section in DataDen as well. I'll take this one too, Travis. So we have our DataDen low rate code report. The actual technical name in there is Candidates for Disenrollment. This was created a while back as a reference for CMAs to look at members that had been enrolled for 12 months or longer in the low rate code. Now we don't necessarily need this report anymore because we have the CES tool that is helping us determine whether somebody should remain enrolled or should be disenrolled from the program. So we just kind of wanted to gather feedback around if anybody was still using this report and if we should keep it in DataDen. We just wanted to make sure that folks were not using this as a replacement for doing the CES tool and that it was kind of a report that was created prior to that tool being put in place.
Yeah, this one was, we brought this one together initially a few years back when there was discussion about low rate code folks and looking at that, and you know, that's not long-term care management, but there wasn't anything tied around New York State budget necessarily on it. It was really starting to look at that and assess that and start having those discussions with those members that hit the 12-month mark. So that was the initial idea behind this report. But obviously things have evolved from 3 years back when this first started to be something that we looked at.
I had a quick question.
Yeah.
In DataDen right now, I have a code that goes to my email, and I don't know if anyone else is experiencing this, but it's taking too long. By the time I get it, it's expiring. Taylor, do you know if there's a way to change how I get the code? You know, I like sort of like I did with NetSmart, where I was able to get the code through my phone.
I don't believe so. I believe the only way to get the code is through email, but I can certainly reach out to ProArc, who hosts our website area of DataDen, and see if that's an option. But as far as I'm aware, it's only through email. But Charles, I'll shoot you an email after office hours, and I may be able to just kind of reset your account and see if that helps.
Awesome, I appreciate it.
We have looks like a hand raised. Michelle. Michelle, you have a question?
Just a thought. I do like having that low rate code right now, because I'd like to see how it compares with how we're completing our CES tool. So kind of like the same concept as the cans and the new acuity levels that are coming out as a result of it. So if it's not that big of a deal, I'd like to keep it, just for a little bit longer, because I find that report useful.
Absolutely. Thank you. Thank you for the feedback. We'll definitely keep it in there if folks are using it. We didn't want to keep it in there if, nobody was utilizing it anymore. But as long as folks are using it and know that it's not a replacement to tell you who needs the CES tool, then that's A-okay.
Yeah, and I think this is a good time to plug too. If folks have ideas for improvement and or report variations, please reach out to us and let us know. I know we've had DataDen up for a little bit now, but we're always looking to improve the platform. And we always do appreciate the feedback and insight. There's things that we may not be thinking of that could be improvements for end product for all of you. So please feel free to let us know.
Yeah, and that being said, there is a report in the hopper. It's taking longer than I'd like it to, but it is coming, that will eventually tell you guys, members that you've had the CES tool completed with, what their recommendation was, and when the next action is due. So if they're due for disenrollment, it'll give you, that day that's 60 days after the CES tool date. If it's continued services, you'll get a date that's 6 months after the original CES date. So that will be coming. That way you guys can more easily track in DataDen at least what members you've had the CES completed on and what their recommendation was.
All right, thank you, Taylor. Comprehensive chart reviews. So I just want to remind folks again, we've been touching on this the last couple office hours, but I bring it up again because it is a change from how we were operating in the past. We've upgraded our percentage of chart reviews to 10% sample from each organization when we do the comprehensive chart audit for that organization. One of the things that we've also done now is for records that are HCBS enrolled youth, there's going to be one audit score per chart. So that would be the chart audit and the HCBS audit score will be combined for that chart score. 85% is the threshold for the comprehensive audit. So any scoring that falls under that, and I know 85% seems fairly high, but that is the threshold to be able to get a 2-year designation now for a lead health home. We don't want less than that. You go down to a 1 year if you fall under that 85%, and then that turns into a provisional scenario, which is not a good setting to want to be in. So we have in our policy 85%. So what does that mean? So that would mean any organization that falls under that 85% for adult and or children, depending on if you are serving both population or one or the other, there would be a performance improvement plan that would be brought forward, and we would work with you with that. The other thing I want to note is it's really important that when we put out the results of that chart review to the organization, to the supervisors, that there's a response back within the established time frame. We need to adhere to the policy that we have in place. And if there's not any response or reply, to the requested timeline, there will be further follow-up outlined through our policy, which everybody's aware of at this point, or should be. If you're not, it's on our website and it's there readily for folks to review again. So I just want to stress it's important that we get that feedback when there are things that need to be responded to and in the time frame that's been established.
Travis, I just have one thing to add, and I didn't take a screenshot for this, but when you guys get your scoring tools for your comprehensive chart audits this year, there'll be a separate sheet for each SIN number that we reviewed. And it'll lay out every question that they missed on their audit and whether or not that question directly needs to be addressed. So, if it's something that needs to be addressed moving forward, it'll state that. But if it's something that needs to be followed up on and completed within the time frame in the quality notebook, it'll state that as well. So I'm hoping that'll make it a little bit easier for folks to decipher what actually needs to come of the comprehensive chart audits and the questions that were marked incorrectly.
Thanks, Taylor. And I want to stress too, we want to partner with everyone. I mean, we're in it together and as a collective, region, as a collective health home network. So we want to work with you. If there's questions along the way, there's issues you're having with certain parts of documentation, please let us know and we can work with you on that. If the audit comes back and you're not seeing things jiving, question it. That's part of the process too. We've had situations where, points were given back because of discussion and follow-up that came back from the care management agency. So that's all part of the process. We want it to be a good discussion, but at the end of the day, where the percentage lies after all that's said and done, and that's all another reason why the supervisors need to be responding to the established timeline so that we can have an accurate reflection of what the scoring is, all said and done. But we want to partner, and it's about working through this together. Our designation relies on all the efforts that we all put in together.
This is Jared again. I want to go back
Yes.
to the CES tool, if you don't mind for a second.
Sure.
Because I just experimented with it. And when I added in just the Health Home Plus SMI and tried to finalize it, it wouldn't let me. And then when I put in all the other information, it wouldn't let me save it. So it's not letting me doing anything unless I put it in draft.
Yes, so there needs to be a supervisor that signs off on it. So that's why it won't let you save it.
Okay. Good to know. Thank you.
You're welcome.
Yeah, so just real quick, it's Jessica, just to clarify on that, the CES tool has to be signed and finalized by a supervisor. So a health home care manager can complete it, then save it in draft, and then the supervisor will go in and finalize the assessment and review it. There is a work list in NetSmart that you can see at the top that will show supervisors all of the CES tools that they have in draft that need to be signed and finalized.
Thanks, Jess. Redesignation, talking a lot about chart outs and whatnot. We're actually due in March for redesignation. We've yet to get anything from the state, so that may be pushed out at this point, I would imagine, but it is coming. So we'll keep on trudging forward as a team collectively and working with each other, but it's on the horizon for us as a health home. Next slide, please. Referrals. So just a couple things on referrals. Member assignments. We just want to remind folks, we want to make sure we're trying to adhere to policy as much as possible. In the event we can't, we should be communicating with the health home. But our children, anybody that's assigned to an organization as a child, it's a 48-hour window to have that response. And then for adults, it's 7 days for policy. So just want to remind folks of that. We've had a number of instances where people have been sitting in assigned status for extensive amount of time. Direct referrals. So that's a referral that has not gone through the health home. We're asking that referrals come through health home. CESTOOL is a perfect example. We're working on outlining our policy. We just met as a group on that a couple times. We're finalizing that, and we'll have that out to the network very soon. But at this point, referrals should really be coming through the health home. I know some organizations get them directly, but it's hard to know if somebody was discharged from another organization because of the CES recommending discharge, and then they suddenly pop up at your organization and you're trying to remorel them, and you find out after the fact that they were just discharged because they didn't meet eligibility criteria. So we want to have the ability for the health home to check that. We have the ability to check prior segments in NetSmart. The person was tied to our network. So that's one of the main reasons we can check and manually take a look at that. And we want to make sure that, aligns and that we have the ability to do that for folks. And then the last thing is we want to make sure that eligibility is in fact in place, right? So if somebody's coming through that is aligning, if the CESTOOL was a factor as well. Next slide, please. Outreach referrals, want to make sure for folks when you have referrals that they have enough information. I know we talked about this a couple meetings back. Something collectively as a network we want to work on. The lead has been culprit of this as well in our internal care management agency. So it's everyone. Make sure we're filling out those referrals as much as we can. If you're getting a referral and you don't have enough information, go back and let that you can't take it until you get more information. If you don't feel that the person's a good fit for the CMA, you want to make sure you're communicating that with the health home. And then the other thing I just wanted to reiterate, it is a responsibility for the care management agency during outreach and enrollment to verify eligibility and appropriateness. You're attesting when you go to bill for that person that they're meeting eligibility and appropriateness. You got to make sure you're checking that as you're going through that process. The health home's doing checks initially to ensure that the person's got Medicaid and they're hitting eligibility, but it falls on the CMA shoulders at the end of the day if they're going to attest to billing that the eligibility and appropriateness criteria are met. So we just want to stress that is part of policy. It's been part of policy, and it will continue to be part of policy. Next slide, please. Budget. The governor, I think folks know at this point, sent a bunch of communications out over the last month and a half. There was a proposed $125 million cut to health home. It's not clear on what that is. There's really a lack of specifics around that. There was a letter that was sent out by New York Health Home Coalition and New York Care Management Association to legislators, and it was signed off by CEOs and CMA supervisors across the state. We sent that out to our network a couple times as well, and it really outlined all the reasons why health home is such a significant part in supporting people with Medicaid that are high risk, and that includes children as well as adults. We haven't heard anything since the February 15th 30-day amendment that the governor released. So there's no updates based on that. There were no changes at that point either. So it's an appending status. But as the advocacy materials come out, we'll continue to pump that out to the network. I can say through the 1115 waiver social care network that was released, that entities are applying for, such as AHI. We're applying to be a social care network for the North Country region. Health homes are an integral part of that social care network process. We're actually mentioned over 20 times in the application itself for social care networks. So it's an integral part of the work that's going to be happening through New York State moving forward. So it's kind of interesting how this budgeting component is what it is at the moment, but going to continue to advocate. We appreciate everybody that has helped to advocate, and just wanted to give you that update. Things are pending still. Next slide, please. Wanted to highlight here and congratulate Champlain Valley Family Center. They actually, shortly after the last office hours, completed their onboarding to start serving children. So they're gearing up to become a children's provider. So they'll be able to start taking referrals and building that aspect of their business. So congratulations. And this is how you can get a hold of us if you have any questions. Did anybody have anything else that they wanted to talk about, bring up? I do apologize for the technical faux pas in the beginning today. That's the first time we've had that come up. Don't know what happened, but I'm glad we got it worked out. But if folks don't have any questions or anything they want to talk about, I want to thank you, as always, for everything you do every day, and appreciate your time today, and hope you have a good rest of the week. Thank you, everybody.
Bye, everybody. Thank you.